Chairman Clyburn, Ranking Member Scalise, and members of the Select Subcommittee on the Coronavirus Crisis. I'm sorry I can't be with you in person today, but I do appreciate this opportunity to provide a statement about the horrific, preventable tragedy that affected my family and thousands of others in New York State. On March 25, 2020, the former governor of New York, Andrew Cuomo, along with his former health commissioner, Howard Zucker, signed an executive order that would put a Category 5 disaster into the homes where our most vulnerable lived. None of us knew that in 46 days, over 9,000 COVID-positive patients would be admitted into their residences. As the deceased were packed into body bags and piled up in storage trucks, Andrew Cuomo and his administration did everything they could to cover it up. I began my advocacy in May of 2020 on behalf of my husband's parents, who both died of COVID, which they contracted in their separate elder care facilities. I needed to find out the truth as to why our seniors were put at such grave risk. Instead of being remorseful or empathetic to our losses, I was attacked and belittled, scorned for where I work, who I might have voted for, and what I did for a living. But even a weather lady knows that putting sick patients into a nursing home is a disaster waiting to happen. Part of my job as a broadcast meteorologist is to make sure when there's a potentially deadly hurricane or a tornado outbreak, there's a dire warning in advance of those who are at risk. That's a big responsibility I take very seriously. Andrew Cuomo knew early on that our seniors were the most susceptible to the virus, and yet he said several times that if COVID got into nursing homes, it would spread like, quote, fire through dry grass. And yet neither his administration or the New York Department of Health ever alerted susceptible family members or help evacuate the residents in harm's way. Instead, they helped light the match and spread the flames. And now, over 2 years later, we still don't know why thousands of COVID patients were admitted into nursing homes instead of the other facilities provided by the federal government, such as the USS Comfort or the Jacob Javits Center. There were many options. So why did Andrew Cuomo give blanket immunity to nursing home operators days after issuing his executive order? And why did he try so hard to cover up the thousands of deaths afterwards? Did it have anything to do with his $5.2 million book he was trying to sell to the highest bidder? A closer look at the timeline and the money trail might give you some clues. But the only way we do that is by doing a thorough investigation, and one that involves subpoenas. We need to treat what happened inside nursing homes as a catastrophic event, one that could have been avoided and was made worse by the people who were supposed to protect us. A situation like this should warrant an after-action review. We must find out what happened and how we can withstand another storm like this in the future. Because if we don't find out now, it will happen again. Our families deserve answers, and we won't give up until there is justice for the thousands of precious lives that were engulfed in flames from a COVID wildfire. And thank you for your time.
Thank you, Mr. Chairman. Thank Ms. Dean, and my thoughts and prayers